Welcome to the OHM BOCES Pre-K to Grade 12 COVID-19 Toolkit informational video. The information provided in this video will explain the toolkit, outline the steps necessary to safely come to work, discuss what to do if you have symptoms that could potentially be an indication of possible infection with COVID-19, or if you have been exposed to an individual suspected to be infected with COVID-19, and the process to safely return to work afterwards. Our daily lives have been impacted by the pandemic, and as such, we need to be aware and diligent in our behaviors and interactions to limit the spread and ensure the safety of all staff, students, our families, and the community at large. Due to the fact that COVID-19 is a new pandemic that the world has not experienced prior to 2020, we are learning facts about the virus and preventative safety measures of how to contain the spread on a daily basis. The material covered in this video presentation offers the latest information from the New York State Department of Health and may be subject to change as new information from current research about COVID-19 and safety precautions to limit the spread becomes available. The health and safety of all members of the school community during the COVID-19 pandemic depends on an understanding of the importance of wearing a face covering whenever they are at school, practicing social distancing, and encouraging proper hand hygiene to limit the spread of germs. Combined with the knowledge of how to respond should any member of the school community potentially exhibit symptoms of COVID-19, or if they have been in contact with a suspected case, this toolkit was designed to be a reference that will address any questions you, as a supervisor, and other members of the school community may have. Questions that may be of concern could include, but are not limited to, what if one of my staff members calls in sick to work today? What questions can I ask them? Who do I notify if my staff member tests positive for COVID-19? Or what if my staff member refuses to take a COVID-19 test?
During the COVID-19 pandemic, there has been a lot of new terminology used, and it can be confusing. Two of the terms that come up most often are isolation and quarantine. So what's the difference between isolation and quarantine? Isolation separates sick people with a contagious disease from people who are not sick. When someone is in isolation, that person must stay home and away from others. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. If someone has been advised by the health department to quarantine, it is a requirement, regardless if the reason was for precautionary or mandatory reasons. During a quarantine, you may not leave your home or have visitors.
The New York State Department of Health has updated the guidance for school staff, indicating that school staff are not considered essential employees. All staff, students, and visitors are required to take the daily COVID-19 health screening prior to entering any building. The following slides in this presentation will review the screening process and the process of when a staff is allowed to enter the buildings and when they are required to stay home. In the past 10 days, has a staff member been tested for the virus that causes COVID-19? If a staff member answers yes and their test result is positive, the staff member is to stay home and stay in isolation until they have been released from the health department. The isolation is in addition to the quarantine order that staff will receive. If a staff member does test positive, they should request a copy of the quarantine order and have that sent to you, so you can provide it to the COVID-19 liaison at OHM BOCES. In addition, the staff member is responsible for requesting the release from quarantine from the health department. If the staff member is awaiting results, they are unable to return to work until they are notified that their results are negative. Upon receipt of a negative test result, the staff member is able to return to work as long as their symptoms are improving and they are fever-free for at least 24 hours without the use of medicines. The staff member will also need to provide a note from their healthcare provider indicating their test is negative, or they must provide a copy of the negative test result. In the last 14 days, has the staff traveled internationally to a CDC Level 2 or 3 COVID-19 related travel health notice country, or traveled to a state or territory on the New York State Travel Advisory List, or been a designated contact of a person who has tested positive for COVID-19 by the local health department? If a staff member answers yes to having traveled, they must quarantine as school staff are considered non-essential employees. The staff member who has answered yes must self-report to the health department, where they will be provided a precautionary quarantine order. If a staff member travels as their own personal choice, they may not be eligible for paid time during the quarantine period. If a staff member has been designated as a close contact of a confirmed positive case, they must quarantine. The staff member will be provided an order of quarantine, which they will need to provide to the COVID-19 liaison.
Quarantine requirements can also apply to members of the school community who may not be experiencing symptoms of COVID-19. This includes anyone who may have traveled internationally or to any non-bordering state in the last 14 days, or those who have been designated as a contact of someone who tested positive for COVID-19 by the local health department. If someone answers yes to having traveled either internationally or to a non-bordering state on their daily health screening, they may be required to quarantine for 14 days or follow the guidance provided by New York State on how to test out of their quarantine. This process involves a mandatory 3-day quarantine upon their return to New York State, followed by receiving a negative test result before their release. A more thorough explanation can be found on the Travel Advisory website. These precautions are important to keep in mind as we are entering the holiday season, and traveling out of state to visit family or friends may become more common. Please be aware that if someone traveled to a flag location as a personal choice and not as a requirement for work, they may not be eligible for paid time off during their quarantine. OHM BOCES staff members and students must follow the New York State Travel Advisory Guidelines and should stay informed regarding New York State's requirements for people returning to the state, as well as any requirements in the destinations they are planning to travel to. Anyone planning to travel out of state should consult the New York State COVID-19 Travel Advisory website. Their information is on the screen, and they offer the most up-to-date information. Members of the school community may be required to provide their quarantine order, release order, or other documentation regarding their COVID-19 health status. Due to the high amount of cases being reported to the local health department, not all individuals may receive this documentation.
Does the student or staff currently have, or has had in the last 10 days, one or more of these new or worsening symptoms as indicated on this slide? It is important to note the difference between new and worsening verbiage as it relates to symptoms. If the staff indicates yes to any of these symptoms, they cannot come to work today. As a supervisor, you must let the staff member know they are to contact their healthcare provider to be assessed. If the staff member does not receive a COVID-19 test, or they are not cleared to return to work by their healthcare provider, they are to remain home in isolation. The following slides will address what happens when a staff member has symptoms and is unable to come to work. As a supervisor, it is your responsibility to make contact with the staff member to find out if they have symptoms, if they have been assessed by their healthcare provider, and if they have received a COVID-19 test. If they did take a COVID-19 test, the supervisor must ask the staff when and where they were tested. This information, along with any and all healthcare referrals, must be sent to the COVID liaison. If the healthcare provider recommends a COVID-19 test, the staff member must stay out of work until they have the results. If the staff member's test results are negative, the staff may return to work if their symptoms are improving and they are fever-free for at least 24 hours without the use of medicine. The staff member must provide a note from their healthcare provider indicating the test was negative or provide a copy of the negative test result. In the event that the staff member's test is positive, the local health department will contact the staff member to quarantine. Once you are notified that a staff member is tested positive, you must report the information to the COVID-19 liaison and begin working with them to assist in their contact tracing efforts. At minimum, when reporting to the COVID liaison the positive test results of a staff member, you will need to provide the staff member's name, date of birth, county of residence, last day worked, what their symptoms were, and when their symptoms commenced, along with where the staff member received their test. The COVID liaison will work with you to provide any contacts that the staff member may have had during the infectious period. Staff members who test positive are not allowed to return to work until they are released from the health department. As a supervisor, please remember to have the staff member provide you with their order of quarantine as well as their release from quarantine. This information needs to be provided to the COVID liaison. If the staff member's healthcare provider provides an alternate diagnosis, such as a chronic condition or strep throat, and COVID-19 is not suspected, the staff member may return to work under the normal guidelines for their diagnosis. If the staff member does not seek an evaluation or does not have a recommended COVID-19 test completed, they must remain in isolation at home and are not able to go to work until the health department has released them from isolation. This typically occurs at least 10 days after symptoms first began, their symptoms are improving, and they have been fever-free for at least 72 hours without the use of fever-reducing medications. All symptomatic staff members and students must be evaluated by a healthcare provider within 48 hours of symptom onset. If an evaluation is not completed during this time, the staff member or student will be deemed positive for COVID-19 and begin their isolation at home. As a supervisor, you must notify the COVID liaison of the suspected case so they can report this to the health department and begin contact tracing. If the staff member has a diagnostic test and there is not a result within 48 hours, contact the COVID liaison and inform them of the lack of the result. Provide the staff member's name, date of birth, where they were tested, and the date they were tested on. The COVID liaison will contact the local health department upon learning of a positive case. The COVID liaison will then work with you to gather contact tracing information of students, visitors, and other staff who may have been in contact with a staff member who tested positive. The contact tracing will include identifying members of the school community who had exposure to the staff member who tested positive, who may have been in contact with the positive case 2 days prior to their symptom onset. The Department of Health will initiate all quarantine and isolation orders. Members of the school community who are affected and are required to quarantine will be under an order of quarantine for at least 14 days from the last date of exposure to the positive case. Members of the school community will be advised to monitor for COVID-19 symptoms and will be recommended to get a diagnostic test at least 3 days from their last date of exposure to the positive case. The role of the Department of Health is to protect the school community during a public health crisis. Remember to answer your phone during these times in the event that the Department of Health must reach you. If you have any questions, you may contact them directly at this line provided here. If someone in your house gets sick, call your primary healthcare provider. Stay home if you are sick except to get medical care. Use a separate room and bathroom for sick household members, if possible. Wash your hands regularly using soap and warm water for at least 20 seconds. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. Disinfect surfaces and objects in the home, for example, tables, doorknobs, light switches, and remotes. Avoid sharing personal items like utensils, TV remotes, food, and drinks. And if you develop emergency warning signs for COVID-19, call 911 and get medical attention immediately. The OHM BOCES Safety Office has gathered the following information for you regarding optional testing sites for completing the recommended COVID-19 diagnostic test. If you are unable to receive a test from your healthcare provider, there are multiple locations available within the community. Some testing locations may require a scheduled appointment. Others will accept walk-ins, and depending on the facility, they may or may not charge you out of pocket for the cost of the test. It is recommended to check in with the facility regarding their policies, as well as your healthcare provider, to determine whether or not your test would be covered and what out-of-pocket costs you may incur. Another option is primary urgent care, located at 1904 Genesee Street in Utica, New York, or 130 West Albany Street in Herkimer, New York. Primary urgent care conducts both rapid testing as well as PCR testing for children under the ages of 6. If the testing sites we've shared are not easily accessible to you, you can refer to the New York State Health Department's website for finding the location nearest you. New York State continues to expand testing for COVID-19, and testing is now available at pharmacies, urgent care facilities, local hospitals, and more. Testing sites run by New York State are offering COVID-19 tests free of charge. If your testing occurs at a private location, such as a pharmacy or medical practice, you're encouraged to check with your insurance provider prior to being tested to determine whether or not you will have to pay for the cost of the test. This concludes our overview of the pre-K to grade 12 COVID-19 Toolkit information. If at any point you have further questions or would like to contact the COVID-19 liaisons directly, you may do so by emailing covidcontact@oneida-boces.org. Thank you for taking the time to review this presentation.